Thank you very much, Betsy. GAVI is one of these unusual public-private partnerships that have grown in the last 10 years, and in fact, next year will celebrate its 10th anniversary. And this alliance has harnessed and brought together the technical and logistical capacity of the international system, reflected here by the presence of UNICEF, one of the major partners, and the private business experience and efficiency of partners such as Goldman Sachs and the CaixaBank and Foundation, with the purpose of increasing access to immunisation in the poorest countries and of strengthening health systems. Now, in the 72 poorest countries in the world, we've successfully been able to introduce new vaccines and strengthen their immunisation and health systems such that they can go further and introduce more vaccines. Immunisation alone could prevent some 25% of the MDG4, the child deaths in the world. And with GAVI's support, we've both strengthened immunisation coverage and helped significantly improve that, but now 70% of the world's children are, for example, protected against hepatitis B, a protection that they'll carry through into their adult life. That's an amazing success story when we started, for example, in sub-Saharan Africa, where most children were denied access to that vaccine simply on the basis of cost. But to enable us to do that, we've had to work and create innovative financing mechanisms, such as the International Financing Facility for the Immunisation, which taps the capital markets and enables us to massively scale up development finance. And to this date, we've been able to realise over $1.5 billion to this agenda, a massive scale-up, one that would have been unimaginable some 10 years ago. And we will be shortly launching the Advanced Market Commitment. This is designed to overcome the market failure that typically delays the introduction by as much as 2 decades of new vaccines and new technologies, making them available sooner, specifically designed for the needs of the poorest families in the world and at prices that will be affordable to the health systems of those countries. Now, excuse me, we wouldn't have been able to launch things such as the International Financing Facility or the Advanced Market Commitment but for the fact that we have this unique public-private construction and that we have people with expertise on the private markets and that we have a legal construction that allows us to do that. Not only in the private sector, but, for example, with one of our key partners, the World Bank, that helps us leverage those bonds and ensure the efficient returns. And, of course, working through the private sector, we're very proud that we have perhaps averted now some 3 million child deaths across the world, but our private sector partners ask us immediately, well, 3 million's fine, why wasn't it 5 million? And I think it's part of that energy and efficiency that we need to inject in some of the ways that we work these days. Human papillomavirus, the cause of cervical cancer, is a very new and promising vaccine, one that's already protecting young women in our richer parts of the world, in Europe and in North America, and one that we would like to see extended into the poorest parts of the world sooner and faster. There are 500,000 new cases of cervical cancer every year. That cohort is growing, and by 2050 will be over 1 million. 85% of those women dying from cervical cancer reside in developing countries, 75,000 alone in India this year. Ensuring access to that vaccine is going to be a critical challenge. But how can the philanthropic and corporate community build on existing initiatives? How can we lever their expertise? How can we help them fill those gaps, those needs for women and girls' health? I'd just like to give the example of the Kaiser Foundation. The Kaiser Foundation represents one of the largest financial institutions in Europe and one of the largest foundations in the world. And whilst it's provided direct financial support to GAVI and to GAVI's objectives, more excitingly, it's used its business network and its reputation to mobilise business in Spain to the same cause, and allow both customers and business leaders in their smaller client base to have that direct access. We face a number of challenges in the future, and we're going to need to increasingly rely on the expertise of the private sector working with the public sector to improve our efficiencies, to look for longer-term, more predictable resources, to look how we can maintain reliable cold chains in the poorest countries, and of securing better and better data in order to measure that progress. I think we've seen a lot within the HIV/AIDS sector about how you can mobilise unique communities. And returning to HPV, I think there's a real chance here that, together with the reproductive health community, the HIV community, the immunisation community, and the